Welcome back to See, Hear, Feel. Today, I'm excited to be with Dr. Richard Carr. Dr. Richard Carr trained in dermatopathology with Dr. Phillip McKee, who has also been on this podcast, and Dr. Eduardo Calonje at St. Thomas's Hospital and the St. John's Institute of Dermatology. He received the Royal College of Pathologists Diploma in Dermatopathology, which is set at expert referral level, and consults on cases throughout the United Kingdom. After being educated in Sheffield, which is north of London, he started practicing in London with, quote, big city ways, unquote. For the last 25 years, he has been practicing in the same community in Warwick, England. He is a dedicated teacher locally, nationally, and internationally, and he is married with 2 daughters. Welcome to Richard.
Thank you very much, Christine. It's a great pleasure to meet you for the first time.
Yes, I also was very much looking forward to meeting you. Could you first share a personal anecdote?
Okay, well, I got a story about badminton. I would have been about 7 or 8 years old. This is back in the early 70s. My father was a formidable man, and we were on a camping site, so a sort of a low-level holiday. Money was quite tight, and there was a boy in one of the nearby tents, and my dad said, "Why don't you go and ask that boy if he would like a game of badminton?" I did, and I spent the whole afternoon just playing badminton with this boy. I came back at the end of the day, and my dad said to me, "Oh, how did you get on?" And I said, "Oh, that guy was brilliant at badminton, absolutely brilliant." And my dad said, "So he beat you then?" I said, "No." I think that would tell you a little bit about my confidence as a child. And it sort of stayed with me throughout my life, the confidence. But that could also be a challenge, having that level of confidence in life, because it's not always a quality that people in the UK particularly appreciate.
I'm going to move on to a different question. What do you think of emotional intelligence and how it impacts work versus home life?
Okay, you can see I'm smiling a lot. Okay.
Yeah. People can hear it in your voice, I think.
My quick response would be, what's emotional intelligence?
Sure, that's honest, yeah.
But I know what you mean by emotional intelligence, and I think, like any muscle, in my case, it didn't exist or was non-existent, because I can tell you it was not something I'd heard about in my upbringing, and certainly the stiff upper lip sort of environment that I grew up in wasn't to really express emotion. Yeah, this confident 7-year-old who really knew no bounds to the limits of what they could do, tempering that and understanding that there are other people around you that you impact on, would have tremendously helped me throughout my personal life and in my working career. I would say I've started to learn about it and maybe strengthen that muscle and work on it, particularly in my later career, actually. I think I've gone through a lot of my career probably with a lot of emotional intelligence, not realizing how much I had, but not realizing how much more I could have benefited from actively exercising that muscle. And interacting with other people would have been far easier for me.
One of your comments is probably actually true for all of us, that no matter how skilled we may feel we are at navigating our own emotions and others, we can still benefit from being better at it. And I like how you put it, like exercising a muscle. And I think that analogy makes sense, because we all know the more you exercise a muscle in general, usually you get stronger and better at something. So I like that a lot.
I think identifying your weaknesses and working on those is obviously the sign of a rounded personality. And I would say I'm not a rounded person. I've been obsessed with many things. And in my family, I'm regarded as the normal one. We're talking about seriously obsessional sort of genes, and also seriously empathic genes as well from the other side. And mixing those two together is like stirring some sort of ridiculous thing. So I would like to have lots of sympathy from all the people out there for people like me with too much confidence who don't realize how important it is to look at the softer skills, which people like you, I would say, have in great abundance. And people like me are hoping to learn from you. So
you shared with me that your mom is an empath, and I assume you probably learned that from her. I haven't heard that term so much, empath. And I think that people also probably define that in different ways. But my concept, you can correct me, my concept of an empath is someone who really feels and takes on the emotions that are around them. So in a way, emotional intelligence is not about being an empath, actually, because the empath in the worst situation, I think, is just completely flooded by the other emotions around them and cannot necessarily function in the optimal way. It's sort of a generalization. I'm not saying that empaths are ineffective in general, but I think that's just the worst case scenario, maybe. Is that your...
Yes, thanks for explaining that, because I see people in my sphere who have that personality type really struggling. Their emotional intelligence, what they need to work on is protecting their core from everybody else's pain and the pain of the world that is around us. Their emotional intelligence needs to embrace the idea that they can say no. They can say, no, I'm not going to take on that person's pain. They are going to set boundaries with the person that's using their empathic nature, who's happy to be looked after, and so on. Both parties in that sort of situation, because often opposites attract, need to be fully aware of the dangers of being too far in any direction.
So how have you worked on your emotional intelligence?
I think I have been told that I lacked empathy or I lacked engagement, that I was self-centered and that I had unrelenting standards, and what else? That I was autistic, that I was selfish. And I agreed with all of those things. No matter what you could say about a person like that with those unpleasant personality characteristics, being aware of them gives you the opportunity to flex the muscles and to reduce those negative sides to your personality. Unrelenting standards makes you a very critical person. So if I'm suddenly being very critical, I have to remember that thought in my head is just electrical activity. It's not real. I'm making up a judgment on something that doesn't exist. Shakespeare said there is nothing good or bad, but thinking makes it so. I could give an example. For example, let's say I'm walking down the street and I see a baby run over by a car. Yes, quite a dramatic example. And I would have an immediate visceral response, wouldn't I? An immediate physical response. And then I run up to the baby to do resuscitation or try and help. And I see that it's just a rubber doll and not a baby. And immediately I'm going to experience a whole different wave of emotions instantaneously. But what happened before the emotional response? My eyes were open, I saw something, and I made a judgment that a bad thing had happened. If you can train yourself when you're in a situation where you're judging it as good or bad, it's an electrical activity in your head, and you're then having a visceral, physical response. You're panicking, all because of electrical activity in your head. And then you would say to yourself, why would I be silly enough to let electrical impulses in my head cause me to panic? When we get wrapped up by the stories that we tell in our head, we then express emotion, and all you've got going on in your head is electrical activity. Interesting, isn't it?
That's very interesting, because listening to this example about the baby, which is really a doll, it's electrical activity, and also it's really about interpretation, right? Like really the thought we construct. So if I had known from the beginning it was a doll, the initial reaction wouldn't have been there, and etc. But my initial interpretation of, oh, that's a real baby, set off a whole different... So this comes to diagnosis, right? Because diagnoses are decisions. They're interpretations, actually. It's my interpretation of a slide, of the features in a slide. Really, any decision is really an interpretation of X, Y, Z, and so I come to whatever conclusion or decision. Given what you've said about yourself being hypercritical and having very high standards, have you created a way to make better decisions for yourself, either at the microscope or just in life?
I would obviously like to think so, wouldn't I? I'd love to give myself confirmation bias that I have done that. I suppose what I'm saying is that if you're showing a reasonable level of commitment, having a reasonably good work ethic over a sustained period of time, we have to look at things in perspective. That art of medicine, for me, is this balancing of the risks. There's a risk from overdoing things, over interpreting things, or thinking of every possible minute, remote possibility because you're a world expert and you've seen everything. Paying attention to your mental, physical well-being, learning from your mistakes, sailing a bit too close to the wind, and then righting the ship and sailing into calmer waters. Give yourself a break. Don't do what I did. Learn emotional intelligence better earlier and sort yourself out. Allow yourself to have your family, your career, and your social and play time. And that will be the key to success.
Love that. So, a related question, we should really do our best for that patient. And like when I think about when I'm a patient, I don't want just okay. I want my doctors to give it everything they've got. And so there's this sort of difficulty. Obviously, if I just talk about myself, I know I'm not perfect and I make mistakes. I will make mistakes. There's no way to not make mistakes other than to not do something, right? Then I won't make a mistake because I'm not doing it. Whatever work we do, but for us, if we're looking at slides and making diagnoses, there will be mistakes. It's unavoidable if you're practicing. Definitely a mistake isn't good enough. And if even okay, which is say not a mistake, but just maybe you could have done it a little bit better, is not good enough. What's a good way to deal with that?
We will get judged. It's just remembering to stick to your core values and your core principles. And if you take the poem If by Rudyard Kipling, when everything's gone expletive and everybody's blaming you, but you're true to yourself and follow the same path, then you will truly be a man. I think it's your core values should guide you. And hopefully as a doc, we hope that our core values and our reasons for entering medicine were generally good and that we will be guided by those. But you're correct, we all make mistakes all the time. I always say I prefer to learn from other people's mistakes, but my own mistakes I learned the most from, and they're the ones that are most imprinted on my brain. I would just be completely open about it. I would be completely open with the patient. I would apologize. I must have made many mistakes because I've seen a lot of glass. And that's one of my things that I say to the trainees, try and see as much glass as you can. You will make more mistakes by seeing a lot of glass, back to your point at the beginning.
Yeah, I love it. Do you have any final thoughts?
I wish everybody out there who's struggling with their mental well-being to be kind to yourself, learn from my mistakes and develop whichever muscle is not well developed. People like myself who are overconfident probably and didn't have very good empathic skills, embrace it, learn it and develop it and make all your relationships better, including your relationship with the glass slide. I have lots of people I'd like to thank, Christine. I've had some wonderful mentors over my career, and I would really like to say a big thank you to David Slater, who was one of the people I met in the very early stages of my career as a medical student in Sheffield. He's really supported me a lot in my subsequent career. I really would like to say a big thank you to Phillip McKee and Eduardo Calonje, who are giants in our field. I was just so lucky to have the privilege of training in St Thomas's Hospital and just being in their orbit. I would like to say a really big thank you to them. There are tons of colleagues locally that have really helped me and supported me and accepted me for who I am, which is wonderful. And I really appreciate the local colleagues that I have and all the dermatologists that I work very closely with and seem to really appreciate DermPath, which is wonderful. I have to make the biggest thank you to my family. I think my personal growth is largely down to being with such a wonderful family. They've kept me balanced, and I can't really say too much about how much they've supported me and given me the opportunity to follow my career path. And hopefully, as I've got more emotional intelligence, I'm also now giving back and supporting them in the way that I probably should have done earlier on in my career. So I really want to say thank you to my very dear family.
I love that. You're one of the first people who have ever credited their family. And I think that shows probably how much you have developed emotional intelligence, because I have been thinking more and more that it's really the relationships that we have with patients through slides or whatever, but also really our colleagues, the people around us, our families that really make life what it is and worthwhile.
I really thank you, Christine. Thank you so much for the pleasure of the opportunity to chat to you today. I really enjoyed it.
I enjoyed it as well. Thank you so much.